Rheumatoid arthritis is a chronic inflammatory condition with predominantly joint manifestations, which result in patients experiencing morning stiffness lasting for an hour or longer. It's a systemic disease, so as well as the joint manifestations, it can also affect the lungs, the skin, the eyes, and also lead to an increased risk of cardiovascular disease. And now we have better treatments for it. It tends to be the secondary things that go with inflammatory condition, like cardiovascular disease, which ultimately affect people's longevity. The end process of inflammation or uncontrolled inflammation in the joint leads to joint damage and ultimately the necessity to replace joints if it's untreated. I think often people think about arthritis as starting in older people, but actually rheumatoid can often start in the third decade of life, so it does affect younger people too. It then has a second peak from the 50s onwards, so it tends to affect the working population. It's more common in women than men, with a sort of distribution of about 3-to-1 women to men. And there are various types. We recognise now 5 different presentations of rheumatoid arthritis.
When I first felt like I had arthritis, I didn't tell anyone about it because I didn't want to believe that I had it. I was only young, going to college and things like that, and I just didn't want to believe. I thought it was something that old people got, and I saw how much it affected my nan, and I didn't want that to be me, so I just chose to put it to the back of my head and ignore it. Obviously it got to a stage where it was getting worse and worse and worse, so I had to tell my mum and my nan about it. And then I went to the GP.
I started with RA when I was 26, so I've had it over 40 years now. But it was very difficult. I was a young mum with 2 children living in a foreign country, so sometimes it was difficult to open tins, just generally go about the general chores of a housewife. There weren't the treatments that there are today.
I didn't realise at the time it was the arthritis that was making me feel rubbish, down, depressed. I was always emotional and teary. But yeah, I had to stop going to college because I just felt drained all the time. So it did affect it quite badly, and I used to just spend a lot of time sleeping, didn't really go out of the house much anymore. And it also affected my life because like things like personal, like getting dressed, washing my hair, all things like that I struggled with, because if a certain part of my body was playing up and I couldn't get my arm in the air, then my mum would have to wash my hair, my little sister would have to help me get dressed, and so it did affect it quite a lot. Like just normal day-to-day things become like 10 times harder than they usually would be.
So if you look at Zoe and her nan, so at that time when her nan first was diagnosed with rheumatoid out in Singapore, she was treated largely with aspirin or an anti-inflammatory agent, and her mother had been treated with steroids, which put her off steroids. She didn't want to have steroids. And it's only actually relatively recently that she started on methotrexate, which is one of the standard therapies we now use. What we tend to do now is we give you an awful lot of treatment at the start when you're first diagnosed, and that will usually put you into remission. And probably about 85% of people, 90% of people with rheumatoid will go into remission on conventional therapy.
I went on to the methotrexate about 3 months ago because I was having a lot of trouble with my wrists and hands. I have over the years had a lot of surgery, a lot of replacement joints. The damage was done when I was young, apparently, but these do ease it, and the methotrexate is working to a degree.
There is a 10% of patients who don't respond to the sort of combination therapies of oral tablets, and that's the group that we tend to use the newer biological therapies to put them into remission. There is a lot of interest at the moment in using the biological therapies right at the start, even before you've had conventional therapies. And that's for patients with particularly bad prognostic markers. And we're now looking at what are called biomarkers to try and decide who's going to do badly with rheumatoid arthritis. And then once we've marked those patients, hopefully give them more aggressive therapy.
Well, after having 3 oral medications that didn't really work as well as they could have worked, I was quite pleased when I found out that there was some new treatments that I could be put on as a trial. So I was quite excited. I was a bit worried, but because I thought I was going to be like a guinea pig, the first person to do it. But then when I realised that it's happened, that the drug's been tested and elsewhere and things like that, I was quite happy to try it and just go forward with it, because I didn't really have anything to lose.
So we have a number of different biologic agents as they're now known, and there are, I think, 5 anti-TNFs, which was the first one, which was introduced actually in clinical trials in the early 90s and then was introduced to the UK in the late 90s, early 2000s, I guess. So when I started in 2001 in Reading, I think there was 1 patient on anti-TNF at that time. There are now 5 different types. They can be administered intravenously or by subcutaneous injection. So there are various injecting devices which look like pens. They all work the same by blocking a particular inflammatory mediator called tumour necrosis factor alpha, which we know is important for inflammation, and blocking it seems to switch off rheumatoid really very effectively.
Since I started the treatment, within the first couple of months I was feeling a lot better in myself. And now I've been on it for 2 years. And I've got no swelling, no aches, no pains, and nothing. It feels like I haven't even got arthritis. So it's done really, really good. You don't have to stay sat on your seat because the machines are portable, and you don't have to stay in overnight. You're literally in. Once it's all done, they monitor you for about half an hour afterwards, and then you're allowed to go away.
So the Image Centre is designed to have patients, it's part of the medical day unit at the hospital, and patients literally walk in, have their treatment and go. So that can mean them staying for as little as an hour on a good day. It's really trying to fit in with patients' lifestyles, because we appreciate totally that trying to come to the Royal Berks, to the Image Centre, is not a convenient thing to do for most patients. But I think also it acts as a hub, so patients can talk to the nurses if there's a problem, they need to see a doctor, someone will come and see them. So they have a lot of input there. And as a resource, I think patients really like it. The other thing we've also tried to do is we've developed a system called Dawn, which was introduced in 2003, and to monitor patients and their blood tests. We can often pick up, for example, when your rheumatoid flares or you've developed a chest infection by changes in your blood. So patients would have their blood tests monitored close by their GP, but we can now see the results. And we have 2 nurses who respond very quickly if your blood tests are abnormal. And the nurses will often be the first port of call. So, for example, a patient has their blood tested in the GP surgery. We'll have the blood result the same day. If it's normal, we don't do anything about it and the patient doesn't hear from us. If it's abnormal, we contact the patient directly, either to ask them are they okay. If there's a problem, we can see them the same day. If there is a problem with their blood test, sometimes it just requires the blood test to be rechecked. It's all done very rapidly with direct contact with the patient, rather than the old system where the patient would have to have the blood test done in general practice. General practice would then have to contact the patient, then see the patient, call us, we'd call them, but now we can see them when they have a problem rather than when we think they should come to our clinics.
I think it works very well. The charity I work with, Arthritis Matters, were instrumental in getting it started. The 6 monthly appointment is a very good scheme in that you do need to be reviewed regularly, but the pattern of rheumatoids is not regular. Therefore, the Dawn scheme is definitely a huge improvement, because people don't go into the depressions, they don't have long periods where they really can't do very much, and it keeps a hold on their sort of lifestyle. The service at the Royal Berks now has gone through huge improvements. It's very heartening to see that people can be treated so quickly, so promptly and so well.
We know that there's a delay of up to 2 years right at the start between patients developing symptoms and actually getting referred from their GP. That's not always the GP's fault. Often patients will just tolerate joint pain because I'm getting old, I'm 50, I'm old. You're not. If you've got stiffness in the morning lasting for longer than an hour, this could be inflammatory joint disease and we should be seeing you. And if it's been going for longer than 6 weeks, you should be asking your GP to send you to see us. So early identification allows us to initiate treatment much earlier in the course of the condition and prevent the structural damage which occurs if you don't do that. I can remember even when I was a house officer working in London that the clinics in rheumatology tend to be full of patients in wheelchairs with a lot of damage and really requiring surgery as their only option. Now I have to say we rarely see that. We have the odd patient, but the majority of patients now diagnosed with rheumatoid can look forward to a much better future with a condition which we can intervene in early, switch it off and prevent the long-term damage which used to really stop people working and really have a massive impact on their life. So I think with the newer biological therapies, they have been a massive advance. More is coming, and I think the future for patients with rheumatoid arthritis is really much brighter than it was 10 years ago.